Sakra World Hospital, Bangalore. We have with us our expert Dr. Narender M, a senior consultant of plastic surgery, to discuss all your queries on tummy tuck surgery. Good afternoon, sir.
Good afternoon.
Welcome to our live program.
Thank you.
Doctor, here are a few questions from our viewers. Shall we start, sir?
Yes.
What should we expect during tummy tuck consultation?
So during consultation, we always start the consultation with getting a detailed history from the patient. In that process, we try to understand what exactly it is that the patient wants from the surgery. And we also explain in detail the various steps that happen during a tummy tuck surgery. So during the initial consultation, we essentially establish an understanding with the patient to make sure that they have realistic goals regarding the surgery and that we can achieve them, and also to make sure that they are fit to undergo the surgery and to rule out any other potential contraindications. So that, and a detailed description about the procedure and what is done. That is what you can expect from an initial consultation about a tummy tuck surgery.
Okay, sir. My next question is, what happens during tummy tuck surgery?
Alright. So during a tummy tuck surgery, what is done is the excess of abdominal skin that is found. It happens typically in women who have had one or two deliveries, post delivery. Commonly we see that situation, but it can happen. But we also do see men who want to address the excess fat in the lower abdomen, causing sagging of the lower abdominal fat skin. So during tummy tuck surgery, this lower abdominal skin with fat is marked out carefully, and during the surgery it is removed as a complete layer from the lower abdomen. And together with this, typically there is a tightening of the abdominal wall muscles that are done in the midline. So this increases the abdominal tone and gives a improved contour to the abdomen, giving especially in women a good hourglass type of shape. And then the excess skin is from the upper abdomen is pulled down, and neatly the excess is removed, and the remaining upper and lower abdominal skin margins are reapproximated in layers to give a very fine concealed scar. So that is what is done in abdominoplasty. In essence, in a nutshell, in a tummy tuck surgery, the excess skin with fat is removed from the lower part of the stomach, and the muscles are tightened so that the overall shape of the abdomen, overall shape of the tummy is improved.
Okay, sir. What should we expect after tummy tuck surgery?
So soon after tummy tuck surgery, we typically leave what we call drains. Drains are nothing but hollow tubes in the inside the stomach, inside the abdominal layer, and this is to ensure that there is no collection of fluid um, under the skin. So we leave drains, and there are typically dressings that we put on the abdomen to protect the suture line, and these dressings are there for a few days. So this is followed by the application of something called a binder, which is nothing but gentle support to hold everything in place. So soon after the tummy tuck surgery, one would find this situation, and typically what we do is that the very next day we get the patients to get out of bed, ambulate, walk, and sometimes we're able to do it on the very same day. We typically discharge the patient on the either sometimes the first post-op day, or more often than not on the second post-op day once they're comfortable.
Okay, sir. What is the recovery time after tummy tuck surgery?
So the recovery time again varies from person to person, and also depending upon their physical condition before the surgery. Some of them who are very fit individuals would obviously recover faster. compared to more middle-aged, elderly, or slightly obese people. But having said that, generally the recovery of tummy tuck surgery is fairly rapid, and most people are fit to get discharged on the first post-operative day or the second post-operative day after surgery. And thereafter, what we advise is to do only mild, light household activity for about 2 weeks. And usually by about a month and a half, we advise them to resume gym, and by about 2 months, they can get back to their pre-op activities.
Okay, sir. What are the risks of tummy tuck surgery?
So tummy tuck surgery is generally very safe. So the risks that are associated with it are very mild and occasional, and they have very easy remedies. They are not. They are typically, if ever complications happen, they're generally mild. So the one of the commonest complications seen is that there can be some infection at the suture line site, sometimes mild dehiscence of the suture lines, especially in the midline. So these can easily be managed with dressings, and they heal spontaneously. And occasionally we can get collections of fluid on either side called seroma or hematoma. Again, all of these can be managed on an outpatient basis. So, barring these, the complications as such following a tummy tuck procedure are rare.
Okay, sir. My next question is what are some long term considerations after a tummy tuck?
So, long term considerations after tummy tuck would include the need for a healthy exercise plan and to have a good diet plan in turn, because the gains from a good abdominoplasty or tummy tuck surgery need to be maintained by constant exercise and by ensuring a good diet at the same time. So
Okay.
those would be the main considerations. The other considerations, of course, are the need to take care of the scars. The scar healing is very important, and this is a something where it's very important that the patients show commitment to that, and with that can achieve a very fine scar at the end of 6 months.
Okay, sir. Is it okay to have tummy tuck surgery before having kids?
Okay, so typically tummy tuck surgery is advised after a lady has completed a family. It is done before, the benefits of tummy tuck surgery typically will get lost in the process of the next childbirth. So we always counsel that to do it after they are completed their family. Having said that, if we are in a situation where um, the couple is not sure when they're going to have kids, and they're not particularly looking at kids in the short term or in the recent future or in the immediate period, then we would advise to go ahead. But otherwise, we generally prefer to do it after they've completed their family.
Okay, sir. My next question is what cosmetic concerns can be treated?
So, through a tummy tuck surgery, as I had already mentioned, excess of abdominal skin together with fat can be addressed. So, we can improve the overall contour of the abdomen, giving it more, giving it a narrower waist, given a close to an hourglass type of shape from the sides, and we can also do combine it with a good amount of liposuction to remove a lot of the excess fat present in the abdominal wall. So these changes can be done with the help of a tummy tuck surgery.
Okay. Doctor, will I have to make any major lifestyle changes after surgery?
So not really. So like I mentioned earlier, the considerations are to ensure that the diet is taken care of and there's a good exercise regimen. So that's all that there's no other significant lifestyle changes that are required in this.
Okay, sir. Okay. Can it be combined with other procedures?
Yes, it can be combined with other procedures as well. Can be combined, like I mentioned before, with liposuction, where liposuction not only around the abdomen or around the flanks, around the thighs, around the hips can be done. It can also be done with uh, like a breast lift surgery, mastopexy, breast augmentation. This can also be combined with a tummy tuck surgery.
Okay, sir. So, would you like to suggest any other suggestions to our viewers, sir?
So, if you're thinking about tummy tuck surgery and feel that you know when is the best time to do it, don't hesitate. It's always worthwhile to get a consultation about it, get it examined, and be proactive about it.
Okay, sir. Thank you. With this, we come to an end of today's live show. Thank you, doctor, for your valuable insights. Thank you, viewers, for joining with us. If you have any queries, you can leave a comment and our expert will answer them for you. Thank you, doctor.
Thank you.